Hello, welcome to the Learning Curve. I'm Marjorie Begin. The lymphatic system is an extremely important part of our body. When it is compromised, a person can suffer from numerous conditions. Lymphedema is one of these conditions, and it impacts over 200 million people worldwide. Nancy Hardy is my guest today. She is a certified lymphedema specialist and occupational therapist working at Sturdy Memorial Hospital. Welcome, Nancy.
Thank you.
Now, before we really get into lymphedema, can you explain what the lymphatic system is and what lymph nodes are?
Sure. The lymphatic system is a system in our body made up of lymph nodes and lymph vessels. It cleans up the tissues. After the vessels bring fluid to the area to nourish them, the lymphatic system takes away about 10% of that fluid. It also helps to fight cancer and infection.
So it really is helping the body to cleanse itself of what it doesn't need?
Exactly. So the veins take about 90% of the fluid away from the tissue, and then the lymphatic system comes and sweeps up about the last 10% of the fluid in a normal, healthy lymphatic system.
Once it sweeps it up, where does it then go?
The lymphatic vessels will bring it to the lymph nodes where it's processed. It will then continue through more lymphatic vessels and return to venous circulation, where it will be pumped back through the heart and hopefully excreted.
So the lymph nodes are actually cleaning the fluid.
Fighting infection.
Yes. And then sending that fluid back into the body cleansed.
Right.
Okay, so that's probably why when you go to the doctor and they start to see if your lymph nodes are swollen, is that one of the reasons?
I think when they're feeling for that, if there is a swollen lymph node, I think it's a sign of infection. It can be a sign of other things, but frequently a sign of infection.
Oh, okay. So now we have this lymphatic system that hopefully is working well within our bodies.
Mm-hmm.
Now, can you explain what lymphedema is?
Sure. Lymphedema is a protein-rich accumulation of fluid in a part of the body. It can be the result of cancer treatment or surgery or trauma. Obesity or chronic venous insufficiency also lead to lymphedema. Now, when somebody has lymphedema, they are more at risk for infection because that fluid is protein-rich and it's a good breeding ground for that bacteria. So the slightest cut or entryway for bacteria through the skin can lead to a major infection. I should also say that some people have primary lymphedema where their lymphatic system is imperfectly developed, and it can appear in infancy or later on in life. The swelling can.
I see. So let's say in a healthy adult, where would we start seeing this maybe developing, the lymphedema?
Typically, it would be after maybe a cancer surgery, not necessarily in a healthy adult. If the adult is healthy, hopefully the lymphatic system is working perfectly. Mm-hmm. It could be from a known cause, like a removal of lymph nodes. Oftentimes it's from people being overweight and their bodies having too much tissue that the lymphatic system can't keep up with it. Or it's the primary lymphedema when we frequently don't know the cause. There was no assault to the body, there's no obesity, but their lymphatic system just didn't develop properly in utero.
So a lot of times it is related to cancer.
It can be related to cancer, especially if there's lymph node removal or radiation treatment. Both of those can be damaging to the lymphatic system.
I see. So I think we were talking and mentioning like women or men who may have had breast surgery for cancer. Mm-hmm. Sometimes their lymph nodes are either removed or compromised. So
Sure.
that sometimes goes hand in hand.
Sure, yeah. A common treatment for cancer surgery is an axillary node dissection or even a sentinel node biopsy, where they will take some lymph nodes from your armpit because they were affected by the cancer. And when they take them, it removes some of the ability to drain your arm or your chest on the affected side, and lymphedema can develop.
So what are the first signs possibly of lymphedema?
That's a great question. So the very first sign is if your arm or leg or body part is heavy. And we want to see you as soon as we possibly can to get the best outcome. But heaviness, before you even see some swelling, is the first sign of lymphedema. People then say that they have skin tightness or they have visible swelling, their clothes aren't fitting as well. They can end up with infections, which leads to more swelling. They can have drainage from where the lymphedema is. But definitely that first sign is that it just feels heavy to you.
So if they have that heaviness, and maybe there is some swelling, first thing to do is
to talk to the doctor, either your primary care physician, or if it's related to cancer, your oncologist, your radiation oncologist, your surgeon. We want to get you in as soon as possible for treatment for that. They also need to rule out some other things. For example, a clot or infection would cause swelling, and we want to make sure that that's not what we're dealing with, or even some other orthopedic cause of the swelling. And as soon as you've been diagnosed with lymphedema, you can get a referral to a lymphedema therapist. You can go to clt.lana.org or lymphnet.org. Those are some good organizations that can refer you to somebody that's specially trained to treat lymphedema.
which could be you.
Could be.
So what would treatment for lymphedema look like?
So the initial evaluation, we do measurements and we take a medical history. And if it's determined to be appropriate, we will go ahead and initiate complete decongestive therapy, which consists of manual lymph drainage, which is a manual technique to reroute the lymphatic fluid away from the affected lymph nodes and towards healthy lymph nodes. And if the lymphedema is in an arm or a leg, we can do compression bandaging, which is many layers of bandaging to help reduce the leg. We also emphasize skin and nail care, and exercise is also an important part of it. And then when people are finished with the treatment, they need to wear either a compression sleeve or stockings, depending on where it is, to maintain their reduction. They need to wear that day and night.
Okay. Now, when you were talking about rerouting things, is that a painful procedure or?
No, it's very gentle, very, very gentle manual technique. So for example, if you have the swelling in your arm, we would reroute it to the other axilla, the other armpit, where they have healthy lymph nodes, and to the top of the leg, where there are healthy lymph nodes also. Very gentle.
So that's done more with massaging or?
Yes.
Oh, really?
Yeah.
Okay. Because it sounded rather invasive.
No. People actually like it. They can fall asleep during the manual lymph drainage sometimes. Yeah.
Oh my.
Yeah.
So if you were going into treatment, about how long would a treatment be, or like a course of treatment for lymphedema might be?
We usually see our patients for an hour at a time, and initially we'll see them maybe 4 or 5 times a week during that acute phase of treatment. We'll do that for a couple of weeks, and then for a couple of weeks after that, maybe just 3 times a week, taper it down. We'll want to make sure that they have their garments before they're done with us. And then in about 6 months, we would have them come back for recheck and make sure that their swelling hasn't gone up, order new garments if necessary, and then we can discuss any advances in the field of lymphology, because there's so many new ones being made.
So it sounds like it's something that can be managed within a reasonable amount of time.
The course of treatment is typically 4 to 6 weeks. Everyone's different, but the initial reduction usually happens pretty quickly, which is nice for the patient and the therapist, very rewarding.
Now, for people who may have very acute for people who really may have very acute conditions Are there surgeries that are involved with this?
And it's not even just for people that have the acute condition. If they have chronic lymphedema and they've had it for a long time, there are some surgeries that are now being done in the United States to help with that. They can do a liposuction procedure. So when people have lymphedema, they will typically have some tissue deposit along with it. So the doctors can go in and remove that tissue with liposuction. They can also do a lymph node transfer, where they take lymph nodes from a healthy working spot and put them in the compromised area. And they can do a lymph venous anastomosis, which is when they hook the lymphatic vessel up with the vein and bypass the lymph nodes altogether.
So for people who may be living with chronic pain, is there pain that would be involved with this?
There's sometimes pain, but it's not usually the first complaint for people with lymphedema. It's chronic infections, it's feeling of heaviness, skin tightness, clothes aren't fitting properly.
All of that. So surgery for people who have been, you might say, suffering in one way or another with this condition, that is a possible solution. You know,
it is coming around now. I don't know very many people that have had the surgeries. There are some doctors in Boston that are doing the surgeries now. And they do say that you need to still wear compression 24 hours a day after those surgeries in order to maintain your reduction. And they do have some very specific criteria about who they will operate on as well. So not everybody is a candidate for those surgeries.
But as a therapist, you have seen that what you do really brings comfort to people who have this, correct?
It can, and just knowing what's going on with your body. Unfortunately, lymphedema is not well known. People, even though it affects 200 million people worldwide, it is not a household word that people understand very much. And people often go undiagnosed for a while before they arrive at therapy. So getting the diagnosis, understanding what's going on, and knowing that there's treatment available can be very helpful for people.
Now, in the Mansfield area, Sturdy has you.
Yes.
And other therapists that are trained to deal and help with lymphedema?
Yes, there are 2 certified lymphedema therapists at Sturdy, so we are very lucky to have 2 of us there. We also have some programs available at Sturdy for people that have lymphedema. We run a support group every other month, and we try to have guest speakers come and talk to us about products or ideas for people with lymphedema. We also have a Strength After Breast Cancer group, and people that have participated in that group have a decreased incidence of lymphedema, and if they already have lymphedema, they have a decreased severity of their lymphedema after participating in that group. And it's also nice because it increases range of motion and endurance and strength to our breast cancer survivors.
So they can really feel that they can go back to a more normal life.
That's the goal.
Yeah.
Yeah.
Well, I know that before I spoke to you, I had no idea what lymphedema is, but it seems like there are many different types, many different ways of it showing itself in the body, but it isn't something that you chronically have to live with. There are things you can do.
Yes, definitely finding a lymphedema therapist is helpful for people who have lymphedema. Unfortunately, it's something that you'll always have to think about and deal with. We like people to learn how to do the manual lymph drainage themselves. And again, they need to be in daytime and nighttime garments to help manage their lymphedema.
Well, thank you for coming and explaining this to us. And maybe we've helped some people today,
I hope so.
and that they haven't thought of telling their physicians some of the condition that they may be feeling, and they know that they can go to Sturdy and get the help they need, and maybe they'll even see you.
I hope so, yeah.
Well, again, thank you for
Okay.
being my guest.
Thank you so much.
And thank you for joining us today, and I hope that you will join us again on the Learning Curve.